Hi everyone, it's Hillary. Tonight I'm going to be answering some questions about antidiarrheals. So, first question is, what drugs are included in antidiarrheals? So, I'm going to focus on two different medications. The first is Lamodal. So, it is by prescription only, and it is actually diphenoxylate and atropine. And the second is Imodium, which is over the counter, and that is loperamide. So the actions of those drugs are a little bit different, but what they do have in common is they prolong the time of contents in the GI tract. So the therapeutic effects or the pharmacotherapeutics of antidiarrheals is it's important to know that they are symptomatic relief. They do not treat the underlying cause of diarrhea. However, they do help minimize symptoms for patients by increasing fecal mass and decreasing fluid and electrolyte loss. So the next question we're going to go over is, someone asked, what are the pharmacodynamics? So pharmacodynamics are actually what medications do to the body, and for antidiarrheals, they actually activate opioid receptors in the GI tract. So it's not like opioid receptors in the CNS, so patients aren't going to get that euphoric morphine-like high. They're just going to what these receptors do is they increase upper GI motility and stimulate reabsorption of water and electrolytes in the upper GI tract, so less fluid actually goes into the small intestine, and the less fluid that goes in the large intestine, the less fluid that comes out with defecation. So that leads us to the third question. How do antidiarrheals work? So this is going to tie into the pharmacokinetics, and this is going to be about the absorption of the drug. So these drugs are both absorbed about 90% in the body. Distribution, not a lot is known about distribution of antidiarrheals. Metabolism, both of these drugs are metabolized by the hepatic system. And then excretion. So about 49% of the drug and the metabolites get excreted through feces, and 14% of the drugs get excreted through urine. So the next question is, what precautions should you use when using antidiarrheal medications? So we do not want to give antidiarrheal medications to children under 2. We don't want to give antidiarrheal medications to patients with a fever over 101, or patients that have bloody diarrhea, or patients that are sensitive to atropine, because Lamodal has a subtherapeutic level or amount of atropine in it. So also, and that is absolute contraindication for antidiarrheals, are patients who have renal or hepatic disease, and patients who have diarrhea because of a bacterial infection, or patients that have diarrhea from antibiotic use, so such as patients with C. diff. So going on to our next question, are there any adverse reactions to antidiarrheal medications? Some common reactions are drowsiness, dizziness, abdominal discomfort, constipation, fatigue. Since Lamodal does have a low dose of atropine in it, you do want to educate and tell patients to monitor for flushing, increased heart rate, rapid or shallow breathing. Okay, next question. Are there any things I should know or be looking out for before taking antidiarrheal medications? Yes, you should always monitor hydration status. You also want to listen to patients' bowel sounds, because you want to make sure they don't have an obstruction or abdominal pain or abdominal distension, because that could be a contraindication for antidiarrheal use. So main takeaways for antidiarrheals. Don't use if diarrhea is from an infectious organism because it may prolong the infection. Don't use Lamodal, the prescription one, if your patient is sensitive to atropine. And only either one, Imodium or Lamodal, only relieve symptoms. They do not treat the cause of diarrhea. And always encourage your patient to stay hydrated.